We've had a lot of good topics that we've discussed. I guess last kind of question I'll have, or what future things are we looking at in prostate cancer? We could talk about local, systemic. What are we excited about to improve outcomes for patients?
I'd say for me, like cell therapy might be a topic of discussion, and I don't know how you gentlemen feel about that, but where do we incorporate that sequence-wise? A lot of my patients are asking about the possibility. They're very adverse to chemotherapy and docetaxel and or cabazitaxel and things of that nature, platinums. So is that something that people are starting to have conversations for, and clinical trials associated with?
Yeah, our institution's looking at by targeting KLK2, so I think that's a very interesting potential treatment pathway.
On the immediate horizon is lutetium, picking those patients in the very frontline setting and kind of balancing that with who's right for that, who's right for chemotherapy. RP plus ADT might be the easy decision, but then plus Pluvicto or plus docetaxel in that frontline setting will be an interesting discussion.
Yeah.
For us for at least myself as urologists, even though most of the things that are going to be most interesting is, like, for example, can we finally harness the immune system in prostate cancer, or at least a surrogate, new therapies and things like this. But our job is to sort of diagnose this disease and cure it before it ever gets to you guys. And the hesitancy in that diagnosis, and then particularly the cure, is the sexual dysfunction, potential urinary dysfunction associated with that early diagnosis and cure. So if we can get to the point where we have lower morbidity there, we can prevent them from ever having to be on the train that eventually goes to the end. And there, we brought up some concepts here early on of can focal therapy be better understood? Can we change how or understand when we do robotic surgery about how we can thread the needle around sparing more nerves and give a safe oncological outcome, but a better functional outcome? And then on the screening end, I think we're starting to best understand how to thread the needle there too, with use of not just PSA, but more involved biomarkers so people don't know everyone doesn't end up overdiagnosed, and even genetics, understand who must be most at risk. It's a question of implementation, but I think our goal is still, identification of the patient, treatment to cure in the localized setting with the most minimal morbidity, so that they never pop into your doors. And even though I'm glad that you guys continue to develop life prolonging therapies for the ones that do escape our grasp.
Yeah, I just want to add on to this because my whole concept of treating prostate cancer the last decade has really become more of an organ-sparing approach, considering some of the side effects that we have seen in our hands with radical prostatectomy, radiation, et cetera. But I think also not much has been done from a standpoint of immunotherapy in prostate cancer world, just because it's such a testosterone androgen receptor-driven cancer. So, some of the studies that we mentioned earlier, you can talk about it as well, can focal therapy induce some sort of immunoresponse? Can that be a pathway for us to potentially even treat some of the more aggressive disease that's localized, but you are inducing a systemic response? And that's why I actually brought the prevention, because I think there are some companies that are, in some studies, that are suggesting this, and I think you may have received.
There may be something there. I think the abscopal effect has often been a little bit of a bust. I had a trial I did years back where I was giving pembrolizumab with cryotherapy, hoping to induce this abscopal event. The only patient, that really had a great response, ended up later, if I remember correctly, it actually was the rare MSI high prostate cancer guy, and then you never know what that means. Mm-hmm. But I think that what you're getting at is, can we somehow unlock some potential through a focal therapy? On a completely different note, we're starting to see phase 1 therapies. They may not work, that are for high-risk localized disease. Maybe think about, injecting the drug in a pellet, injecting enzalutamide right into the prostate lesion, and preventing systemic therapy, toxicity, and some of that's happening. But I think more so for us, imagine a future where there was something to visualize the nerves when you did a prostatectomy, and or to overlay where the disease was, or to understand who's going to fail out of field with focal better. You talked about PSMA imaging, and sort of nip some of these cancers in the bud. I think that's our space is really going to be preventing them to get to you guys, maybe to capitalize on some of the technologies. But I worry because we've been burned before. It's just like with immunotherapy, when every time it spikes up and something comes, like there's, CAR T therapy comes out and everyone gets excited that like, we're going to get our bullet. I think we have to overcome this barrier to the immune system that prostate cancer has. But as time goes on, I sort of lose a little bit of enthusiasm,
Yeah.
and I get more for the other therapies. Bite therapy is interesting though. It's kind of a different concept in some ways, but let's see.